I had a patient who had inflammatory bowel disease. You should know IBD is inflammatory bowel disease, which is ulcerative colitis or Crohn's disease, whereas IBS is irritable bowel syndrome. Two totally different things. There's no confusion. If you have Crohn's or colitis, your doctor's going to find it. It's pretty simple based on your symptoms and the right test done at the right time. So this patient had that and she was resistant to medication. She didn't want to take it. She got on for a long time, then had developed serious symptoms that needed her to be on serious medication. Once you take the medicine, I always tell patients, if you take the right medicine, you keep this disease under control, you're in control. If not, the disease is going to control your life. Once you take your medicine and you have a normal, healing and the colon becomes normal, then you have a normal quality of life. So she came back for a follow-up and I was telling her about preventive care, especially when you take serious medications, biologics, things like that, for your Crohn's or colitis. Your immune system is how they work through that. You're not going to catch every single infection, but you need that medication to control your immune system and inflammation in the colon. So what happens is you don't want to expose yourself to things that would be sick, make you sick, seriously sick. So anything preventive, like flu shots or pneumonia shot, things, vaccines to prevent infection, you should do it. Shingles is such a painful thing. You never want to experience it. Even if you had shingles before, you must take the shingles vaccine also. Only dead vaccines, killed vaccines. You cannot take live vaccines. That's one thing when your immunity is suppressed or you take any of these medications to work through your immune system. So we go through the whole list and tell her what kind of medicine she needs. Go see a skin doctor because some increased risk of skin cancer happens. Don't think these are side effects and I don't want to take the medicine. When it's not an option, you are going to have enough symptoms because of the disease. So you need the medicine. Your body's going to demand it. But also don't worry about the side effects because the complications of the disease are worse. That's what you need to remember, especially because of the environmental changes in the food and things we are exposing our bodies to. We see this colitis and Crohn's in a lot younger patients as well as in older patients. When diagnosed right and treated right, they are no problem. And you want to continue the preventive care, keep up with your doctor, or you're going to end up with more complications that may not be controlled easily later on.